very strong in the face of adversity katulad ng mga nangyayari ngayon. Okay? So next we go to the, okay, tingnan niyo yung forehead nyo kung may mga horizontal lines. No? So ibig sabihin, nag-effort ka talaga to know more about life. Parang ang dami mong pinagdaanan. Ito kasing forehead natin up to the eyebrows, this would represent ano yung mga pinagdaanan natin from age 0 to 30. Okay? Mga Chinese alam yan. Kaya pala may mga ako tumitingin talaga pati sa mga ilong. Okay. Yun. Tapos meron siyang crow's feet sa corner ng eye niya. Nakikita niyo yan. Crow's feet. Okay, this is testimony to the breadth of this vision. Na ibig sabihin, nakikita natin yung big picture kahit hindi mo siya pwedeng baguhin. Okay? So ibig sabihin, mas malawak yung pananaw mo. Yun nga lang, ayaw natin magkaroon ng crow's feet. Okay, I hope that helped. So, ano yun si Ma'am Teresita, nakaka-relate?
Yes po.
Parang.
Hindi kayo para relate.
Yeah, sige, bilisan natin to kasi medyo marami tayong pag-aaralan. Okay, kahapon, kagabi, we talked about lung problems, lung deficiency, lung Qi deficiency, kung paano ma-differentiate natin yun by looking at the signs. Okay? So tonight, we are going to learn more about, wait lang. We will learn more about the lungs. Any questions before we proceed? Okay, for the benefit of those na hindi masyadong familiar sa ating mga pinagsasabi, we are going to review ano po yung ibig sabihin ng lung Qi deficiency. Okay. Ano yung lung yin deficiency? Okay. Biglang nawawala. Okay, punta tayo dito sa ganito. Wait lang po. Okay, pag-usapan natin ano po yung lung Qi deficiency. So pag sinabi nating deficiency, kulang yung energy ng katawan, no? So pag sinabi nating Qi deficiency, ang dila mo medyo walang kalatoy-latoy, flabby siya, no? Yan, hindi siya firm. Okay, flabby, slightly flabby. Okay, yung tongue body niya may look normal kahit deficiency niya is not very severe. If the deficiency is not very severe. And yung tongue appearance will vary kung anong problem, anong organ ang involved. Okay, lung Qi deficiency, think about kulang na yung function ng lung. Kulang na yung energy. Okay, alam naman natin na ang lungs, kinokontrol niya yung ating energy or Qi, saka yung respiration. And kasama ang spleen, okay, ang lung organ is most often affected by Qi deficiency. So anong pathological signs, okay, na mayroon ka ng lung Qi deficiency? Shortness of breath, weak voice, spontaneous sweating. Ibig sabihin kahit hindi mainit, pinapawisan ka. Okay? Pag hindi masyadong severe yung lung qi deficiency, wala tayong makikita sa dila. Okay? Pag medyo matagal na po yung lung qi deficiency niya, pwede siya maging swollen sa anterior third, no? Or anterior part between the tip and center. Okay? This would be the only sign of lung qi deficiency. Okay? Sometimes yung lung area, meron siyang thin white coating na slightly moist. Okay? Ang ibig sabihin nito, nag-retain ng cold sa lungs dahil nagkaroon ka ng previous infection at ako being cold hindi masyadong na-treat. So, pag meron tayong lung qi deficiency, meron kang mahinang pag-ubo, shortness of breath, o pwede kang may asthma, sleep apnea, no? Yan. Meron kang weak voice, environmental allergies. So, yung mga marating may allergy, pwede siyang lung qi deficiency. Okay? Kaya minsan, pag meron kang COVID, nag-trigger po allergy. Madaling kang okay?
Ano ba yun?
Yung iba pa pinute lang ang ano ha, kasi nakaka-distract. Okay, let's go to the tongue. So yung pinaka-peculiar po na characteristic dito is depression. Kung nakikita niyo, naka-depress ang anterior third. Gusto niyo pong subukan, Ma'am Betty?
Excuse me, Dok. Wala akong ano.
Hindi man makita ang slide po, Doc.
Sorry.
Kayo lang ang nakikita.
Okay lang.
Okay, kita na po.
Opo.
Okay, please say something.
Pale tongue, swollen with teeth mark.
Okay. Ano na po nasa utak natin sa description na yon? Anong pattern po? Pag pale red, ano kaagad na sa utak natin? Deficiency or excess?
Deficiency po.
Very good. Pag swollen.
Lele. Kumatin. Depression in anterior third. Meron siyang depression dyan.
So ano yung napag-aralan natin kagabi pag may depression sa anterior third? Ano pong
lung yin deficiency?
Balik ko muna yung kagabi ha. Ibang hindi nyo nag-gets. Ang bilis yung makalimutan.
Ay, na-kidney.
Sige, review muna tayo ha. Para, ewan ko kung nakaka-relate yung iba.
Sir, di po ba stomach?
Ano po?
Stomach.
Okay. Yung tongue. Depression sa anterior third. Ano po ibig sabihin nun? Like, what is it?
Deficiency in the jaw.
Sige. Mukhang mali. Kidney essence, hindi rin po. Ang kidney essence deficiency ng root.
Upper jaw.
Post.
Upper jaw yan. Yeah, okay. Upper jaw.
Deficiency in the upper jaw.
Okay. Since we don't see any difference, wala siyang crack nakikita, no? Tsaka meron pa siyang konting, ang ano kasi dito, wait lang, bakit ayaw ito lumabas? Okay, review po muna natin ha, para makasagot tayo. Wait lang. Bibilisan ko lang. Ay, hindi. Bakit wala? Wait lang. Sige, let's talk about lung yin deficiency first.
Okay na po, Ma'am Rox.
Okay, pag meron tayong lung yin deficiency, since mag-ina ang lung pati kidney, pwede siyang maging kidney yin deficiency or pwede siya nanggaling sa kidney yin deficiency. So ano ang mga clinical manifestations? Pinapawisan yung ating chest area, sternal area, yung palms and soles of the feet. Ito yung tinatawag na heat in the 5 centers or 5-palm heat. And then meron tayo may low-grade fever pag afternoon and evening. Yin deficiency, diba? So dryness of the throat, weak cough, diba? With scanty sputum na pwedeng mayroong blood. The tongue will be red, peeled and dry at pwede kang makakita ng 1 or 2 cracks sa lung area. Okay? So what are the tongue signs associated with lung yin deficiency? So pwede ka magkaroon ng lung yin deficiency kung habang nagkasakit ka. For example, nagka-COVID ka for 1 week. So pwede magkaroon kasi ang infection kasi may natutuyuan yan eh. So nagkakaroon tayo ng lung yin deficiency. Or kung medyo mahina yung ating constitution, pwede siyang nanggaling. So yung mga mahina ang kidney yin, pwede siyang magkaroon ng lung yin deficiency. So yung pinaka-important causative factor na isolated, ibig sabihin walang ibang pattern, lung yin deficiency is smoking. So alam naman natin, pag hindi tayo tumigil sa paninigarilyo, it can generate heat sa lungs. So think of it this way. Nagkaroon ng heat sa lungs, so nagkakaroon ng clumping ng lung fluids. So ito yung tinatawag na smoker's cough, which typically occurs in the morning. I don't know if some of you can relate to this. And pwede ka mag-expectorate ng thick discolored phlegm. Okay? And many years of smoking will lead to a dry or irritating cough, a result of phlegm drying up. So, ang heat in the lung, nakikita natin yan sa anterior third ng dila. And of course, since may heat sa lungs, dahil sa smoking, it will be red. Pag advanced stage na, dahil meron ka ng injury sa lung yin, magkakaroon na tayo ng small thin cracks. So as long as you don't see cracks there, hindi pa siya lung yin deficiency or hindi pa siya severe lung yin deficiency. Okay? The color of the tongue body, pag affected na po yung lung yin, is very often reddish or red. So pag ang tagal na natin nagtatrabaho sa mga maiinit, tuyo, dusty conditions, nagpo-cause po yan ng lung yin deficiency. Example nito yung mga baiters, pati miners. Now, pwede din siyang masira yung lung yin by external dryness. Pwedeng masyadong mainit yung panahon, or may central heating, or natutuyo ka dahil sa aircon. No? Dryness sa lungs, nagkakaroon tayo ng dry cough. So pag ang pasyente natin, meron ng dry cough, dry throat, or mouth, meron na po tayong lung dryness. So pag meron na tayong lung yin deficiency, may manifestations natin are hoarseness, makati yung lalamunan, occasional bluntage due to feeling of heat in the body or of subfebrile temperatures in the afternoon will also appear. Now, yung dryness din sa lungs, pwede din natin makikita pag dry ang tongue. Okay? And yung tongue body niya will be intense red kung meron ka ng both lung and kidney yin deficiency. Now, sino-sino ang pwedeng magkaroon ng lung yin deficiency or lung qi deficiency? Yung mga teachers, singers, pati mga actors. Kasi ginagamit nila yung boses nila sobra. So pag natin ginagamit yung boses natin, hindi tayo marunong mag-modulate. Humihina po yung ating zong qi o yung gathering qi. Itong zong qi na to, yung energy, it controls the strength of the voice and it will influence also the speech. So kung nawawala na yung boses natin, blame it on the gathering qi na humina na. Kasi it supports the qi of the heart and lungs. Ano po yung early signs or early onset of gathering qi deficiency? Meron pong depression in the anterior third of the tongue, pati maputla po yung dila. Okay? Yon, pale tongue body. Kasi qi deficiency. So, pag kung katulad nito, nakikita nyo, bumabaon na po yung anterior third, no? So yung essence nasa likod, sa root, ito po nasa anterior third, okay? So ibig sabihin, yung trabaho nito siguro, kumakanta or nagle-lecture. So itong ganitong classic individuals may have a tendency to catch colds, no? So pag meron kang deficiency of gathering qi, pwede ka rin magkaroon ng heart and lung qi deficiency. So nakikita rin itong gathering qi deficiency sa mga taong may long-standing sadness and grief. Pag tayo malungkot, dinidisperse niya yung lung qi at saka humihina. Disperse means ini-scatter, no? Parang tinapon mo yung lung qi. Kaya yung boses mo parang naiiyak ka, no? And medyo hindi maganda niyan, humihina yung heart qi. Kasi nga 'di ba, gathering qi deficiency. Okay? So yun. So if sadness and grief remain unresolved for many years, yung lung qi deficiency pwedeng mag-evolve into lung yin deficiency. Ang red tongue body na may maraming maliliit na cracks, pagkatapos plus merong depression sa anterior third, okay? Lung yin deficiency po yon, onset. Pero pag wala pang cracks, gathering qi deficiency po. Okay? Yan. Patients who suffer from stomach yin deficiency, they will often show signs of lung yin deficiency. So pag naubos na po yung fluid sa stomach, magiging undernourished din po yung lung yin. So stomach yin deficiency that leads to lung yin deficiency, may nakikita tayong vertical cracks sa midline at saka small cracks over the anterior third of the tongue. Okay? So frequent illness caused by wind heat, ibig sabihin parati kang may sore throat, tapos yung ubo mo parang kang kumakahol, this can lead to lung yin deficiency. And also, pag meron kang persistent, ang tagal-tagal na ng ubo mo, nasisira yung lung qi mo initially, eventually it will affect the lung yin. Pag fever naman, feverish mga illnesses, ibig sabihin, ang heat nakapasok na po sa qi level, tapos naglilinger sa lungs and stomach, magkakaroon po ng red points sa anterior third. Okay? So, ibig sabihin, meron na pong toxic heat or toxic heat sa lungs yung pasyente. So, pwede siyang mag-produce ng lung deficiency kasi syempre heat, nauubos yung fluid, nasisira yung fluids, na-injure sa stomach and lungs. And there will also be specific tongue signs indicating lung yin deficiency. So let's go back to our slides. So let's continue, Madam Betty.
Wala pa ho yung picture.
Wait lang. Mahina ang kalaban. Okay, nandiyan na.
Sorry.
Sige, tuloy natin, ha? Maputla yung dila, sabi nyo.
Swollen.
Depression in anterior third. Pero ba tayo nakikitang cracks?
Wala pa.
So, ibig sabihin, most likely, ewan ko kung tama tayo, hindi ko pa nakikita yung answer.
Lung chi.
Meron siyang gathering chi deficiency.
Lung
Okay.
chi deficiency.
Bakit po siya may runny nose? At saka sneezing fit, atchi ng atchi.
Yung sa lungs niya.
So, tightness of the chest, definitely meron na siyang lung chi deficiency, di ba? Meron ba siyang symptoms na pinapawisan siya?
Wala.
Okay. Difficult breathing, that tells us, okay, lung chi deficiency. Tendency to catch colds, ibig sabihin, gathering chi deficiency,
Yes,
di ba? Oh, let's take a look. Diagnosis niya ay, di ba? Lung
Chi. Tama.
deficiency, gathering chi, and lung chi. Kasi may shortness of breath. Spleen chi deficiency dahil nga merong hit marks, maputla, swollen.
Swollen. Dampness ang swollen.
Actually, hindi siya maputla, normal kulay ng tongue siya, pale red, di ba? Okay, ano ba yung napag-aralan natin? Pag normal yung kulay ng tongue, pink or pale red, chi deficiency. Okay. So, ang Western diagnosis po, allergic rhinitis, allergic asthma. Background, family history of allergies. So definitely, mahina po talaga yung lung chi niya. Maswerte siyang namana yung lung chi deficiency. Saka opera singer siya, di ba? Overuse of voice. So yon. Overwork. So overwork, nagkaroon ng spleen chi deficiency. So nag-accumulate ng dampness. Bakit sinabing dampness? Kasi swollen na po siya. Saka irregular eating habits. Any comment, Dr. Gavino?
Tama lang, sir. Pero meron ako napapansing very fine cracks. Ay, naku, I'm sorry. On-mute pa. Pero merong very fine cracks na just above the depression.
Yeah. So yes, this one. Or itong transverse, no?
Yeah.
Most probably, sa stomach niya nag-isa. Pero the cracks are very minute, no, to notice. At saka, slow bagong kulang remember, I was wrong when I said pale. Pale red pala is the normal color. So that means, siguro, if the crack were deeper, siguro nagbago yung itsura ng yes, probably, yeah. It could have been, yeah.
Sir, paano yung nangingitim dun sa root? Is that just a shadow?
Yeah.
It is toxic heat.
Yes, that's a good observation. Although, kasi nakita, kung titingnan nyo, malalim siya. No? So I think Roxanne was correct when she said there could be onset essence deficiency. Pero we base it kasi sa symptoms ng patient. Kasi like what I have emphasized before, Dr. Gabi asked me, when do you say it's liver chi constraint? When do you say it's liver chi stagnation? If there is an emotional component, let's say nagalit siya or so yung liver chi stagnation. Pero kung wala naman, dahil lang sa exhaustion physically, that's liver chi constraint. Okay? Yeah, that's a good observation, Doc. Yeah, there are actually cracks. These are horizontal cracks. So kasi usually pag mahina po ang spleen, humihina rin po yung stomach chi. So since yung cracks niya, medyo more horizontal, very minute. This could be the start of stomach-in deficiency. Okay? Yeah. And also, I would like to add, kasi medyo parang iba ito, hindi lang pinakita, kasi siguro nakafocus tayo dito lang sa depression on the anterior third. Okay. Now let's proceed to the next case. Ma'am Teresita, do you want to comment? 56-year-old female.
My spleen deficiency siya, Doc, dahil po sa pale with slight teeth marks. And then my
It is a
lung
fail rate.
pale with slight teeth marks. Spleen yin
Spleen chi.
deficiency.
Okay. Depression in anterior. Tingnan niyo po.
Anterior third. Right third. Lung chi deficiency, Doc.
Mhm. Slight
Anterior
red.
third.
Okay.
Slight reddish of tip. May lang Then dry throat, dry cough,
Tip
tendency
siya.
to catch colds,
Hindi naman siya. Bakit lang? Tip na siya eh.
alang hit,
Red tip.
red tip. Sa
Tip.
heart na siya, Doc. My heart hit siya.
Heart heat konti. Okay, what about the yellow thin greasy coating sa posterior third? That is also very significant.
Stimulation of dampness sa
Dampness and heat.
Okay, very good. Damp heat. Damp heat because there's a greasy coating, although it's thin, the color is yellow. Okay. Damp heat probably in the lower burner, lower warmer. Okay. How do
stimulation of
you apply
lower
the dry throat? Dry throat, dry cough.
So my lung chi deficiency siya. And then insomnia, exhaustion.
Tendency to catch colds, meron po siyang gathering chi deficiency. Constipation, pagkasama pati yung dry cough and dry throat, meron na po tayong heat, di ba?
Yes po.
What of insomnia? Is the cause of insomnia? It could be this one. No?
Yeah, not grounding.
Yes, very good. Doc. Now let's take a look. The Western diagnosis is prolapse of the uterus. Remember, if you have spleen chi deficiency, you can have a prolapse uterus. Diba? So the spleen is supposed to keep the organs in place. But in this case, in Western diagnosis, although this could probably, okay, what about overwork? Dito na po yung diagnosis. We were correct. There is slight heat in the heart.
Yes
There
po.
is damp heat in the lower burner. Yeah. Slight accumulation because irregular yung distribution po ng coating. And I think you mentioned kanina lung chi deficiency.
Yes po. Lung chi
And
deficiency.
deficiency, very good. And spleen chi deficiency.
Because of the overwork, pati ang teeth mark at pale ang dila.
Okay. Next, we go to the 65-year-old male. Take note, tingnan nyo.
Yeah, off
curl
topic,
up
off
na
topic. Pwede, sir.
Dish with curled up.
Play.
Pero
Emotional.
off topic lang regarding the last case.
Ano po yun, Doc?
Would it point to sinking chi? Spleen chi sinking
Yes. Yeah.
instead of just spleen chi deficiency?
Because of the Western diagnosis, diba? So I guess from
Yeah.
to be more specific about it, especially pag may Western diagnosis na, you would definitely say it's spleen
Yeah.
cheesing. That's a good observation. Thank you.
Yeah.
Doc. Wow.
Sir, another off topic.
Oh, yes, please.
Pwede pa, sir? Isang off topic. Kasi long, during the past week, when we were talking about sinking chi, somebody commented that his example is Bell's palsy. Totoo po ba yun? Can you...
No.
Sinabi po niya hindi ko lang naabutan yung...
No.
Inihabol pa niya na yun daw, isang example niya ng sinking chi is Bell's palsy.
No.
Hindi po, no?
No. It cannot be spleen, what's this? Spleen cheese sinking. Another good example is hemorrhoids.
Yes.
Or rectal prolapse. It cannot, Bell's palsy is never spleen cheese sinking.
Oo nga po.
I would
Fever
want,
wind.
yeah, wind yun, di ba?
Yeah. It is wind hit or wind cold.
Yeah, maybe I was doing something else. Pero hindi. Whereas ganito po yung mga presenters, sana they wouldn't feel bad. Kasi minsan, may nasasabi tayo, minsan wala tayo sa tamang di ba, Ma'am Teresita?
Then kaya ko lang nasabi yun because not to mention anything about it would be a perpetuation of a mistake.
Precisely, yeah. I do not remember hearing that. Perhaps I was busy doing something. Anyway, sige lang, I will look into that. Baka pag okay.
Recording po ba kayo?
Ano po? Hello?
Are you recording the discussion? Hindi nyo na po makikita yung kung hindi naka-record.
Ay, no. We're not recording it. Sayang. Sige po.
Yeah, sir.
Okay. Anyway,
Ano po lang,
to that po, I cannot remember when was the time we talked about Bell's palsy.
we're talking about sinking, sir. Ano sabihin nyo? We're talking about sinking. Ginawa example ng isang
Naalala nyo yun?
Opo.
Yes.
Nagtalo nga kami ni Tuk Abin. Kayawang kami.
Ano niya?
Sabi ko, hindi, win yun.
Go. Kasi mayroon ako papakitang dila na medyo ngayon ko lang napansin. Kung hindi pa natin ito inaral, hindi ko napansin yun. Tingnan natin kung mapapansin nyo. Okay, let's go to the next case. 65-year-old male. Do you want to comment, Dr. Gabino?
Yes. There is a definite hit in the lower jaw.
Okay.
Because of the yellowish and thick coating. There are cracks in the stomach
So what does this indicate?
area.
Coating.
It indicates heat.
Yeah, damp heat,
Damp
diba?
heat.
Damp heat, yes.
Accumulation of in the lower burner.
The tongue is swollen, raised
Yeah.
at the edges, with cracks in the area of the stomach, extending
Okay.
up to heart area.
Okay.
Ang crack.
This time we have a vertical crack in the anterior third.
Yes.
No, nice tongue. What about so what is your diagnosis here, TCM doc?
DCM,
Vertical.
madami Meron, vertical.
Vertical crack in the anterior third. Are we thinking of the lung? Kasi reddish na po yung tongue Reddish na siya. So definitely, saka ito may
Heart
diba?
na.
Yin
May hit in the lung.
deficiency niya.
Yin.
Diba?
Yin.
Okay,
Pati-
ang question now is, paano natin ito correlate sa symptoms? Okay, shortness of breath upon exertion. So definitely, at saka may napansin ako, malalim din po itong kanyang
Oh,
may depression. There is pain during urination. So this speaks well of this one, right?
Kidney.
ay,
Sa kidney, may kidney and deficiency siya, and
Of
accumulation of
burner.
damage burner.
hit.
There is back and abdominal pain. Oh, abdominal pain. Don't tell me lower burner pa yan.
Middle burner na.
Middle burner.
Stomach.
Intense thirst is a giveaway. There's a lot of heat. Let's take a look. Ito po yung Western diagnosis niya. Coronary heart. Ay, by the way, we also missed one. Curled up edges. Curled up edges. Liver cheese.
Liver.
Kasi pag orange to, una-una naman, we cannot say it's liver blood deficiency because the tongue is not pale, right?
Red
Kasi-
shadow.
Yeah, so pag liver blood deficiency, orange na siya. Yeah, so this
So,
time,
my liver heat, shadow, liver constraint.
yes. Why liver chi constraint? Because there is no emotional component. Hindi siya nag-complain na nagagalit siya or irritable. Yan na yung liver chi constraint. Okay? You don't say liver chi stagnation. O, di ba? Western diagnosis, coronary heart disease, kidney stones.
Type.
Ito na yung dampit niya. Type 2
Hindi siya
diabetes.
dampit and the lower burner.
Kaya may kidney stone.
Smoking for 35 years. Heavy physical labor. So liver chi constraint. Ito yung nag-cause ng liver chi constraint, no? Pati, ano pa ba? Accumulation of damp heat in the lower burner, slight spleen chi deficiency, lung and heart yin deficiency. I missed that. Kasi abot pala sa tip, yung vertical crack. Thank you. Let's go to the next. 41-year-old male. Who would like to comment? O, tingnan niyo po, ano pa rin?
Wala pa, sir. Yun.
Slightly red.
Sige po, sir. Sige na, diretso. Dr. Gavino.
Ako, sir.
Yes, please. Go ahead. This is
Favorite mo ako ngayon, ha? There is a
Sige na.
stomach area, redness on the heart area, curled up edges, which are red.
So what is your diagnosis
The
here?
vertical crack up to lungs.
Ano ibig sabihin?
Lungs.
Cracks in the
Red.
anterior third. Take note, you already have cracks in the anterior third.
Yeah,
Lungs. Yin.
your third. Yung sabi mo kanina, constraint, gathering chi deficiency.
Mm-hmm.
Yeah. Langin.
Yeah, that liver chi, wala ba yan? There is definite enlargement of the tongue with slight teeth marks, but the edges are curled and reddish.
Okay, so let's go.
My liver yang
And there is some
Dito na,
coat. Andyan na,
Dito na. Frequent
acne vulgar.
without fever. So, nagkaroon ng heat. Heat in the liver, heat in the lung. Abuse of nicotine, black tea, cannabis, irregular lifestyle. Meron siyang acne vulgaris. So, liver chi constraint. Okay? Kasi ito very red,
Constraint lang.
Constraint lang. Kasi walang emotional component po. Irritable lang dahil mainit. Last, we have the 58-year-old female. Who would like? Oh, this time we have a normal colored tongue.
Well,
Red is normal, but it is very swollen. It's big, swollen, dry, cracked in the anterior third and center of the tongue. So that means middle and upper warmers. Frequent colds with cough, shortness of breath, swollen lower legs, dizziness, intense inner feeling of cold. Take note, intense inner feeling. So that would tell us there is probably what?
Damp cold.
Let's take a look.
kidney young.
Young deficient.
Yin and yin deficiency. Dela yung kidney yang
Kidney
deficiency.
young deficiency.
So may edema of the lower legs that confirms the kidney young deficiency. Okay? Saka yung intense feeling of cold. Chronic bronchitis. For years, her work required that she stands, overwork, blockage of lung chi due to accumulation of dampness, blockage of water pathways. So onset of lung yin deficiency. Last would be the 28-year-old female. Pangit ang dila niya, no?
Square.
Square.
Very square. Okay,
Ganyan.
let's
Sila yan.
diagnosis. Pale red, pale edges. So definitely meron na po itong liver component, liver blood deficiency probably, I'm not sure. Deep horizontal cracks in the center and the anterior third. Middle and upper. Slight swelling, anterior third. Ano ibig sabihin pag swelling? May heat na konti, di ba? Red in anterior third. Okay, may heat na talaga.
Doc, my constitutional heart weakness, constitutional weakness of the heart.
So, Western diabetes niya,
Dela.
sinusitis, chronic bronchitis. Sorry, blood deficiency pala. Spleen chi deficiency with blood deficiency. Stomach, yin deficiency, lung yin, retention of phlegm in the lung. Kasi nag-swell na pala ito. Sa kanyang, meron kasi siyang slide. Meron siyang may phlegm, no? Nasal congestion. Okay, heat in the upper burner. Dami pala nito. Okay, we have the last one. Sino po gusto? Last na yata ito.
Wow.
Take note, the tongue is thin.
Blood deficiency siya. Pale.
Okay. Irregular cracks in the anterior third, yellow dry coating without root in the posterior third. Chronic dry cough, dry mouth, thirst, inability to fall asleep. Kasi meron na siyang mga red dyan.
Lung deficiency.
Irregular. Okay, onset of lung yin deficiency, kidney yin deficiency, with retention of damp heat. Spleen deficiency, slight blood deficiency. Okay, bago tayo maubusan ng oras, punta po tayo sa ating na totoo.
Meron na.
Okay.
Meron tayong pumasok na mga guests ngayon, baka maubusan na tayo ng oras. Pero dahil wala si Ma'am Roxanne na siguro yung pang niya tomorrow na lang yung
Hindi ka kasi umiimik. Sige, anyway, may papakita akong tongue. I don't know if you're familiar with this tongue already. Asan na yung tang kanina nung ano?
Parang nag-message si Ma'am Roxanne. Inasa ko sa iyo sa messenger mo. Yeah.
Huwag magpasa habang nag-ano na, mahirap. Buti sana kung iba yung post.
Kaya nga sabi ko bukas na lang kasi late na rin eh. Tumawag siya kanina. Tumawag siya sa akin. Nasa loob na tayo. Sabi ko sige lang. Asa ka lang. Tapos if ever mapaano ko kay Ma'am Roxanne, maipapasa ko. Pero kung hindi, sige tomorrow na lang. Pero pinapapasok ko siya para makinig lang.
Okay. Wala naman yung tang na inano ko, hindi yata na-save. Grabe. Wait lang po. Sana pinapadala yan at least an hour before kasi ang hirap kasi in the middle of the ano, then ililipat ko pa yung I hope you understand, no? So it's not very easy to be posting and then okay. Anyway, any questions po? Bukas na lang natin tingnan yung tamo, madam. May change siya. Pero may nakita ako na kakaiba sa dila mo. Dito na pala. Meron pa tayong few minutes. Okay, buti na lang yung topic natin ngayon was about ito po yung new tongue ni Ma'am Teresita. What can you say, Ma'am Betty?
Oh, great improvement. Ganda na. Sementado na, Dok.
Sintado na.
Masaya na.
Wala na rin siya masyadong wings, Ma'am Betty.
Masaya na, oh.
Ano ba yung napansin natin, ano ba yung napag-aralan natin? Pag malalim yung anterior third, ibig sabihin matagal na itong malungkot. Pero lately, ewan ko na, kung baka naman sa pagkuha, no? Hindi na siya malalim. It will probably confirm by, kasi tingnan nyo to, ang lalalim mo.
Opo.
At saka
Ganda
meron
na.
Puro ng picture.
no?
Galing.
Ano
Tingnan-
Parang
talaga?
bangka. Parang bangka.
Ang putla-putla. Ito naman, halata na yung dump kit niya dito sa kanyang lower
Sa
breast.
corner.
Kidney essence deficiency.
Depleted na kasi
Noong
essence.
September 30, were you very sad here, Madam Teresita?
Saan, Doc?
Yan, may crack.
Ano
Alam
to?
ano ba?
Gathering Chi deficiency,
Yan.
crack na siya, di ba? Langyin na to, deficiency. Any comment?
Yun nga yun kasi nabahala na si Sir Tim kasi sa third session nawala na daw yung dump heat. Pero sa 8 na bumalik na naman. Ikaw, sige lang sir, don't worry, gagaling ako in God's perfect time.
And,
O pag chronic ba naman, ilang
Basta-
taon mo na yan dinevelop, ma'am? Tapos gusto ni Sir Tim, maaalis in just few,
Hindi
Kasi
ganun pa.
reklamo ko sa kanya kasi masakit pa ang finger joint ko.
So, pag-usapan naman natin yung mga guests mo, hindi kaya sila nanibago? Baka akala nila mga natutopak na tayo dito.
Kaya nga sabi ko to, kasi inimbita ko lang yan mula sa page. Tapos sabi ko, makinig lang kayo kasi this is a traditional Chinese medicine approach.
Okay.
Wala pa masyadong background to sila.
Actually, dapat binigyan mo sila ng background.
Ngayon nga lang kasi, yung isa ngayon lang tumawag na ma'am, gusto ko pumasok. So, di makinig na lang.
Sige. Yung dila po, yung passport. So, yung kagabi, hindi na bumalik. Okay, so maraming salamat po. Tuloy lang po sa pag-aaral. Okay, parting. Thank you sa mga nag-attend.
thank you, Doc.
Thank you,
Thank you,
Dr. Dela
everyone.
Cruz, Dr. Gavino.
Salamat po.
Maraming
Galing
salamat po
na.
sa inyo lahat ng
May
pumasok.
kinumbida akong
ngayong
kaibigan,
bago.
si Tidum Kapunan.
Okay. Hindi ko sinabi. Sayang. Saan yung dila niya do?
Hindi, kinumbida ko para makinig. Kuha na po yan. Ako puncturist po yan.
Yes,
Very good.
Sabi ko, makinig ka para ka matuto.
Yeah.
Sige,
Dapat pag bagong pasok, may dalang dila.
Oo nga. Para ma-enjoy din nila. Pero sa mga baguhan talagang na walang ka-background, nang alam nilang consultation, yung tinatanong ka ng history tapos inaanuhan ng stethoscope, maninibago talaga sila dito na pwede palang ma-analyze yung internal na kalagayan ng health natin through sa dila lang.
Totoo. Siguro naman, no, papat nag-enjoy si Dr. Gavino. Kung
Opo,
hindi
very much. Very much.
Obra.
Bilis ni Doc matuto eh.
Ang galing niya.
Doktor eh.
Hindi ko ganun kadali, no? Iba yung sa theory. Iba rin yung actual na nakikita mong dila. At saka ang dami mong i-consider ng mga factors. And I'm confident we can achieve something big. So thank you sa lahat for joining us in our pag-aaral, kahit 1 hour lang a night, no? And hopefully bukas po ulit.
Thank you po.
Ingat.
Sige po, salamat po ng madami.
Thank you, Doc.
Pero,
Good night.
night everyone.
Night.
Night, everyone.